Hey there. Subscribe to my channel. And also press this bell icon.
Start with the name of Allah. Ebola outbreak. Objectives. At the end of this topic, you will be able to know about what is Ebola, mode of transmission, sign and symptom, diagnosis, treatment, vaccine, and how to prevent Ebola, and do and do not of Ebola virus. Ebola virus. Ebola is a deadly disease caused by virus. After entering the body, it kills the cell, making some of them explode. It wrecks the immune system, causes heavy bleeding inside the body, and limits almost every organ. Ebola virus disease, also known as Ebola hemorrhagic fever. First appearance of Ebola. The disease was first identified in 1976 in two simultaneous outbreaks. Nazira, a town in South Sudan, in Yamoussoukro, Democratic Republic of Congo, a village near the Ebola river from which disease takes its name is Ebola virus. Recently affected countries which are listed below: Nigeria, US, Spain, Liberia, and every country with confirmed Ebola cases. Source: WHO and CDC. A mode of transmission. People can get Ebola in West Africa by preparing these sick animal or food. The virus spread by direct contact with body fluid, such as blood of the infected human or other animal. Healthcare workers have frequently been infected while treating a patient with the suspected or confirmed Ebola due to the close contact with the patient. Natural reservoir host of the Ebola virus has not yet been identified. Researchers believe that the first patient became infected through contact with the infected animal like chimpanzees, gorillas, fruit bats, and monkeys. The type of blood fluid that involved in the transmission of the Ebola virus, which include saliva, sweat, and blood. The contaminated objects through which Ebola virus transmitted: needle, syringe. Other way in which Ebola virus can transmitted: touching the solid cloth of infected person, having sexual contact with the infected person, handling under unsterilized medical equipment. Sign and symptom: incubation period 2 to 21 days, fever, headache, joint and muscle itching, sore throat and weakness. These are followed by diarrhea, vomiting and stomach pain. Initially, stomach symptoms include high fever at least 102 Fahrenheit. In some cases, internal and external bleeding may occur. This begins 5 to 7 days after the first symptom. Death, if it occurs, follows 6 to 16 days from first symptom and is obtained due to low blood pressure from fluid loss. People are obtained in a coma near the end of life. How Ebola symptom progress. Infection with the Ebola virus can lead to the flu-like symptom, bleeding, both visible and internal, and in many cases death. The current outbreak has a mortality rate of around 60%. Diagnosis of Ebola. Ebola is often confused with malaria, typhoid fever, and dysentery, etc. So Ebola is diagnosed through saliva and urine tests. Blood samples are tested for the viral RNA and viral antibodies or for the virus itself to confirm the diagnosis. Detecting the viral RNA by polymerase chain reaction (PCR), detecting protein by enzyme-linked immunosorbent assay. These are the methods best used in earlier stage of disease and also for detecting the virus in a human remain. Treatment effected begin within 4 days and continues for 10 days course. There is no stand treatment or vaccine for Ebola, only supportive treatment which include balancing patient blood, maintaining oxygen, blood pressure and treatment any complication. A new drug target for Ebola virus. Researchers have recently developed a new drug target in the Ebola virus that could be used against. University of the Utah chemists have produced a molecule known as a peptide mimic that display a functionally satirical region of the virus that is universally concerned in all known species of Ebola. How to prevent from Ebola? If you have sudden fever, diarrhea, vomiting, go to the nearest health facility. Make no contact with Ebola affected people. Use a special kind of cloth while treating Ebola affected person. Conclusion: in a nutshell, we can say that prevention is better than cure. Thank you for your. It is a question which EHF stand for Ebola hemorrhagic fever. Thank you for your attention.